If you've been diagnosed with type 2 diabetes, you're not alone. In fact, over 29 million Americans are living with this disease. That's nearly 10% of the population. Now, there are numerous treatments out there available, but the most effective is making healthy lifestyle choices. I mean, look around. There's lots of things to do outside. Often the unhealthy choices can contribute to the diabetes diagnosis in the first place. So let me show you now the dangers of type 2 diabetes and why it's known as a silent killer. Akimi has been living with type 2 diabetes for some time, but she doesn't know she has it. The lifestyle choices she's making now are laying the foundation for future health implications that can impact her life. Let's go inside Akimi's body, see the effects of type 2 diabetes.
Our first stop, the pancreas. The food that Akimi is eating is loaded with unhealthy carbs, like sugar and saturated fat. In a healthy individual, the pancreas regulates the blood sugar and adjusts for whether you're having a meal or whether you're in between meals. Notice how glucose in the blood is rising because of food. The pancreas will release insulin to regulate blood sugar levels after eating. Insulin tells the body cells, like those in the liver and muscles, to take sugar out of the blood and use it for energy. But for someone like Akimi, while the pancreas is still producing insulin, the body cells have stopped listening to the signal, which causes sugar levels in the blood to rise.
You wouldn't know it by looking at her, but Akimi's blood sugar is at a dangerous level. This elevated blood sugar begins to create physical symptoms. She becomes extremely thirsty and fatigued. Now let's head back inside Akimi to show how the effects of uncontrolled blood sugar are wreaking havoc throughout her body.
Elevated blood sugar causes problems for all the organs because it has bad effects on the vessels that supply them with the vital blood they need. High levels of sugar in the blood make the vessels weak and leaky. They can even form clots that block blood flow. This happens in the heart to these important vessels known as the coronary arteries. They supply the blood the heart needs to keep pumping. When they get closed off, the result is a heart attack or death. Now, let's take a trip north to Akimi's eyes and witness how sight can be damaged due to retinopathy. Now, we all know what the eye looks like on the outside, but this is the inside of the eye. It's called the retina. It's filled with fields of special cells that react to light. These cells send signals to your brain that let you see. All of these special cells here, right here in the retina, need a constant supply of blood to do their work. You can see the blood vessels all around here, all these blood vessels. High blood sugar causes these sensitive vessels to become occluded, and without blood, the retina cells die off, leading to vision loss. Finally, we travel to the kidneys, where a healthy, fully functioning kidney looks like this. But here we see the beginnings of diabetic retinopathy. Kidney damage, which can lead to failure. Just like in the eye, the kidneys have teeny little vessels that also get damaged. In diabetes, since the kidneys act as sort of a filter, when these blood vessels are compromised, they start to leak proteins and blood into the urine. As the damage accumulates, the kidneys can scar over and eventually die. If the kidneys don't work, your body can't filter the blood and get rid of waste. If this goes on for long enough, dialysis becomes necessary to keep a person alive. Fortunately, type 2 diabetes can be controlled. Taking medications as instructed by Akimi's physician is an important first step. Incorporating Blue Zone project habits will also make significant impact on Akimi's health. Living a more active life and moving naturally can provide the exercise that is essential for Akimi to improve her overall physical health in a way that she enjoys. Good nutrition is an important component to managing this disease. By following the 80% rule, Akimi will stop eating prior to feeling completely full, which can help promote weight loss, and limiting her consumption of meat and focusing on a plant slant diet rich with fruits and vegetables will play a significant role in improving Akimi's health.
Look around, gaze at how many things you could do outside. With simple, healthy lifestyle changes, Akimi and others like her can live a long life, reverse the damage caused by complications, even reverse the diagnosis of type 2 diabetes. Aloha.